So I think it's important because, especially women, we tend to really worry about our breath. We can identify a problem, whether that's by mammogram or physical exam, or our partner finds something. Some lucky people can tell when their blood pressure is elevated. They get a headache.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of a Kidney Coach, Kidney Disease Solution, and our formulas Cardiovascular. And I'm joined again today by the beautiful, amazing Dr. Ellie Campbell and her dog there in the background.
Yeah.
And Ellie is a family physician, a functional medicine doctor. And what I love about Ellie is, and if you go back and watch some of our other podcasts, you'll see her story about how she really got into functional medicine through treating one of her favorite patients, and her story of what happened with her journey, which is really amazing. But the other thing I want to say about the amazing Ellie Campbell is that she has just written a book called The Blood Pressure Blueprint, and it is all things blood pressure and how to treat it. But what is really amazing about this book, there it is, thank you, hold it up, be proud woman. It's an amazing book because think everything you know about blood pressure and just think salt and diet, not exercising, and then think, throw it out the window, you don't know anything. Dr. Campbell knows everything about blood pressure, because there are so many things that contribute to elevated blood pressure and cardiovascular disease, leading to things like chronic kidney disease and all of those sort of things that most of us aren't taught about, because we know that hypertension is the second leading cause of chronic kidney disease, being end stage of that, and that heart disease and heart failure and heart attacks are, I don't know, where do they sit on the cause of death in the US and
Yeah,
the world?
US #1. Cardiovascular disease, the #1 killer in our country.
Right.
February is American Heart Month, so we do like to focus our attention on hearts during February. It also happens to be Valentine's Day.
It
Um,
does.
and so I think it's important because, especially women, we tend to really worry about our breast health. And the media attention to breast health is wonderful, but only 1 in 31 women die of breast cancer, and 1 in 3 women die of cardiovascular disease. So
Yikes.
it's a 10 times bigger problem, and people don't pay attention to it. Partly, I think, because breasts, um, we can identify a problem, whether that's by mammogram or physical exam, or our partner finds something, but hypertension is usually silent. Some lucky people can tell when their blood pressure is elevated. They get a headache, or their ankles swell, or they feel a rush in their, or a thumping in their ears. Those are the lucky people, because if
Mm.
they can identify that their pressure is elevated, they'll be motivated to make a change. But that's not most people. Most people, it's a silent stealer of vitality and organ function. And if we identify it by properly checking our blood pressure at home and at the doctor's office and getting trends over time, then we can start to identify who really has blood pressure problems and who doesn't. Because there's some sneaky things. Number one, there's this thing called white coat hypertension. And these are people who live all the time at home in perfectly good control. But as soon as they see somebody in a white coat, their blood pressure skyrockets. And we will over-treat people, strip them of their nutrients that are needed to metabolize the blood pressure medicine, and increase risk of side effects and complications, not to mention dropping their blood pressure to the point where they could get weak, dizzy, and even pass out, fall down and get hurt by over-treating blood pressure if we diagnose it only by the readings we take in the office. And just like with a diabetic, I would never in a million years make a treatment for a diabetic based on a single blood sugar reading that I got in my office. I need trends over time. I need a continuous glucose monitor. I need 3 times a day blood sugar checks. Send me your log. Let's look and see. And so now we need to do the same for blood pressure. And surprisingly, home blood pressure monitoring has only become a thing really in the last 5 or so years, right? It's not been commonly recommended to people. And I think that's been a mistake. And now that we know it, we can do better, and we can start checking our blood pressure. I tell my patients that, I like to think about blood pressure like son-in-laws, right? Or potential son-in-laws. You
You
want to
obviously
know
have
what your
daughters, right?
son-in-law is like on his best behavior, but you also want to see what he's like on his worst, crabbiest day, right? Because how's he going to treat your daughter? You need to know these things. Well, I think the same is true of blood pressure. I want to see it. How good can you make it when you're meditating and life is grand and you have no pain and you slept well and you haven't had your coffee yet? What's your blood pressure look like? Or right after you drove home in rush hour traffic and there was a car wreck and you're an hour and a half behind schedule and your daughter needs something for school that she just told you about, that now you have to stop doing everything to go run out to the store to go get that thing, and you're irritated and cranky. And now what's your blood pressure look like? Because these are the moments of physiological stress that can drive your blood pressure into a dangerous range if you're not well controlled. And so we want to be certain that we see all these trends. So checking properly. And a lot of people make a mistake when they check their blood pressure. First of all, you have to be seated when you measure your blood pressure. You're not supposed to check it standing at the kitchen counter. You're not supposed to check it when you're lying down. Kudos to those dentists who take blood pressure in the dental office. I am so proud of them. But most of the time they take it laying down, and that's
Yeah.
not the proper position. We should be seated. We should be seated with our bottom to the bottom of the chair, our back to the back of the chair supported, and our feet on the floor. If we don't do that, if we have our back muscles that we're using to hold ourselves upright, we can raise our blood pressure an extra 10 to 15 millimeters of mercury. So,
Really?
yeah. So we want to have back to the back. Now, I have a secret how tall I am. I don't tell everybody. I'm only 5'1". And so when I sit in a chair with my back to the back, my feet don't touch the floor. They swing like a little kid. And if my feet are not resting on the floor when I check my blood pressure, I can raise my blood pressure about 10 millimeters of mercury. So
Really?
we need our bottom to the bottom, our back to the back, and our feet on the floor. I have never in my entire career been offered a step stool to rest my little feet on when they check my blood pressure.
Funny what small little nuances can do, isn't it?
Yes. Another thing that we do wrong often in a medical doctor's office is we test the patient with a full bladder. Your bladder should be empty before you measure your blood pressure. Having a full bladder can add 10 millimeters of mercury to your blood pressure reading. And if your bladder is painfully full, that elevation may persist for 3 hours because of the way that we stretch that bladder and the sympathetic signals that are sent through your bloodstream. You know, we often will go to the doctor's office on purpose with a full bladder because we know they're going to ask us for a urine specimen. So we're holding it and we're holding it. And they're like, hold on, let me check your blood pressure. Let me get your vital signs. And then I'll send you to the toilet to go collect a urine specimen. That's the wrong order to do things in. We need to send them to the restroom, let them empty their bladder, and then check their vital signs. Or we risk raising their blood pressure just by doing it in the wrong order. Who knew, right? These are all things that are listed in the new 2017 CDC, American Heart Association guidelines.
I highly recommend it to anyone with kidney disease, especially if you know hypertension is the driver or anyone in your family has hypertension. Again, I'll put all Dr. Campbell's details below and a link to the book. If you want to know more about what we do, head to www.kidneycoach.com. We're also on Instagram and Facebook and all those good places. Remember to hit subscribe and like. That way you get notified when I get Dr. Campbell back on to talk all things micronutrients when it comes to elevated blood pressure. Dr. Campbell, thank you again for your time. I know you've been busy and just got back from the Amazon and just celebrated a birthday not long ago. Happy birthday.
Yes, I did. Thank you so much.
Pleasure. And again, thank you for being part of our community. And we look forward to seeing you all next time. Bye.
Yes, ma'am. Bye now.